Hi, I'm Paul Callinan from Recruit Personnel and I'm providing additional information as part of our application for the 2025 Hunter Safety Awards.
So Paul, tell us, why did you decide to review the work health and safety management system?
Well, as a labour hire provider, one of our key challenges is that we have workers out on multiple work sites with multiple employers. That makes control of their day-to-day activities, from our perspective, incredibly challenging. And one of the issues that we clearly identified was that we were having some workplace incidents and some safety occurrences across those sites, and we really didn't have a lot of control. So we decided that the best thing to do would be to undertake a full safety review and implement a new work health and safety management plan.
So Paul, tell us what you did next as part of that review.
We had worked with Red Insight, so Monica and James Brown, for a number of years. What we decided to do was to get Monica in and undertake a full safety review or full safety audit. Through that audit process, that was probably in October 2023, and through that safety process we identified that we had a number of areas that we needed to work on. I did take a little bit of time to consider how best to progress in regards to that, but by about March of the following year, we decided that we would embark on a full work health and safety management review. And as we started to get into that process, we decided to go that one step further and undertake ISO accreditation for safety management. So the next part for us was that we knew that we needed to revise our work health and safety management plan, but we didn't want to have a document that would just sat on the shelf. So it became essential for us to find ways to embed the changes that we were going to make into our operational systems. So for us, we use a database called JobAdder to manage all of our day-to-day operations. We wanted to embed as many of these changes into JobAdder so that our consultants would have access to that information and make sure that we were employing or engaging with our work health and safety management system. For us, we have a number of stakeholders in this process. So we have our host employers, we have our employees who we on hire, of course we have our internal employees and management. So we had these multiple stakeholders, not to mention the various external stakeholders. So we started to get into this process and really tear apart our systems and find new ways to improve what we do. Some of the simple changes that we made were embedding questions within our job order form, making sure that we were asking employers up front what sort of work health and safety management system do they have in place. So getting a really detailed understanding of the job in the first instance, but then also building an understanding of what they have in place and what their attitude towards safety is. Because if a host employer has a poor attitude to safety, then there's no chance of it being a safe work site. So we started that process very early. We have embedded a number of forms that can then go out directly to a host employer to check and see what they have, what systems they have. But we also then started to pursue the candidate side. So when we're engaging with candidates through the interview process, we're talking to them about their experiences, about what their attitude to safety is. So we're looking for ways that we can actually tie all of this together. We then started to get into our induction process, making sure that we were compliant with our induction process. One of the simple areas that we had to address was under 25 workers. We didn't have anything in place prior that really satisfactorily addressed that area. So we started to embed information into our induction, but then we took that the next step and made sure that we embedded that information into our assignment notifications that are going both to our host employers but also to our employees, so that the parties all understood what their obligations were. Once we got someone out on a job, we then had to monitor that workplace. So we'd go and we've rebuilt our workplace inspections to make sure that we're actually asking the right questions and gathering the right information, and we're committed to going out to our host employer sites. But we also then went and put monitoring into that so that we can monitor that a host induction has happened, in the first day that they're on site. That the employee's been shown all of the basics, has been taken through the safety exit, knows where the lunchroom is, has been provided with site-specific safety information and has a better understanding of the role that we're sending them out there to do. So there was a number of steps that we've had to build in, and we've captured that in our database so that we can track, record and report. So there's some of the significant changes that we've made to really make sure that our work health and safety plan goes from something that sits on a shelf to a document that helps guide us in our day-to-day activities, that helps us to reduce workplace accidents and injuries and incidents on site, and helps us to engage more both with our host employers and their supervisors and our employees. I've got to say that it really is working so far. Our incident rate is reducing, and right now, touch wood, we don't have any current workers' compensation cases out there. And for us, that's quite an achievement because we have had periods where we've always had one on our books over the last few years. So to be able to be clear for now has been wonderful. So it's been a really important step forward for the business. The ISO accreditation has just added some accountability, I think, into it for ourselves. And so far, we think it's working great, and we're really enthusiastic about this work health and safety journey that we're undertaking. And we're looking forward to continuing to pursue this path and provide better outcomes for both our host employers and for our employees and for ourselves.